Zuranolone. All right, let's talk about it. I am learning along with you right now because this is not something that I had known. I told you I haven't been paying attention to the news this week, so let's learn about it together. So FDA approves first oral treatment for postpartum depression. Now, I guess that's a little bit misleading because, of course, we can use other types of antidepressants. Yeah, it definitely does sound like the name of a new drug. But actually, Zuranolone is that's not even the brand name. The brand name is Zurzuvae. Are the Zoomers in charge of naming drugs now? What is this? I think this has to be a joke. It's not approved for use during breastfeeding. Have you seen the ovary socks from Sydney Sock Co? No, but I do have ovary socks. No, I have uterus socks. Sydney Sock. Y'all just gave me all the I have 100 things now that I need to look up. You have to check them out. It was amazing. I don't know what that's in response to. It's not responding to me. Sorry, Rohini. I am interrupting your conversation. My gosh, there's hardly any... I don't know how people keep up with the chat when there's more than the amount of people that are here right now. I know they don't respond to everything, but even just reading it just scrolls by too fast. Someone with Crohn's. I have come across some interesting medication names. Can't pronounce most of them. Yeah, me too. I mean, I still struggle to pronounce a lot of them. I also cannot stay on topic at the moment. Yeah, Merkitty. So the not being approved for breastfeeding, and we'll get back to looking at the medication real quick, but not being approved for breastfeeding just means that it hasn't, a lot of things don't get approved for breastfeeding. So almost always with breastfeeding, it's a risk-benefit discussion. So most of the time we don't have data and stuff on that, and it's just a discussion with your doctor. Okay, so today the US FDA approved Zurzuvae, the first oral medication indicated to treat postpartum depression in adults. Postpartum depression is a major depressive episode that occurs after childbirth, can also begin during the later stages of pregnancy. Until now, the treatment for PPD was only available as an IV injection given by a healthcare provider in certain healthcare facilities. What is this talking about? So, yes, we need more information on how people respond to various medications when being treated for postpartum depression and specific data on postpartum depression, because what we typically do at this point is just extrapolate information from a general medication standpoint for other depression and anxiety type disorders and just extrapolate that. So yes, we need specifics, but this is a little bit misleading that the only treatment for PPD before was an IV injection. I would say that is, the only approved one maybe, but it's not the only medication. So had two randomized double-blinded placebo-controlled studies, and that's all their inclusion criteria. The labeling contains a boxed warning noting that Zurzuvae can impact a person's ability to drive and perform other potentially hazardous activities. Patients, wow, that sounds not like a great side effect that you'd want while you have a tiny baby at home. Patients also may not be able to assess their degree of impairment. To reduce the risk of harm, patients should not drive or operate heavy machinery for at least 12 hours after taking Zurzuvae. Wow. I need to look up the detailed information on this. That just sounds kind of horrible. I wonder if maybe it's more well tolerated than it is letting on. Zuranolone, formerly called Sage 217. They should have kept that one. May be efficacious for depression and appears to have a relatively rapid onset of action for 2 weeks. Okay, they're talking about that. And this is just not peripartum depression. It's other depression. Okay, adverse effects that occurred in at least 5% of patients. In the US, it's available only through research protocol. Well, that changed, I guess, today, but or over the past couple of days. I still don't know what the class of medication is, and it's driving me bonkers. What is the mechanism of action of this medication? A GABA receptor. Okay, so It's a GABA receptor model. Positive allosteric modulator of the GABA A receptor. And most common adverse effects. I want to know how often these happen. Let's see. I'm sure you're all really interested in this you can't tell me any new and exciting things like this and expect me not to go down a rabbit hole and drag you with me. It is really hard to find information on things like this when they first come out. Okay, here we go. All right. So, dosages and strengths. Yeah, so it's saying that there's an increased risk of suicidal thoughts and behaviors in patients who are under the age of 24 and specifically under the age of 18. This is not an uncommon side effect of some antidepressants in teens and young adults. It's definitely something that people should be aware of and talk to their... Okay, here we go. So adverse effects occurring in over 2% of patients. Somnolence, 6% in placebo, 36% in Zurzuvae. That is a very high number. Man, I think that is a bit worrisome for how many patients are going to actually keep taking medication, because if you are a new parent and you have a baby that doesn't talk, I'm trying to read and talk and process. Yeah, so somnolence is being sleepy, being drowsy, or overly tired. If you have a brand new baby and you're postpartum and you have some peripartum depression and you're not sleeping, that exacerbates it. So getting more sleep is always helpful. It's honestly a very hard advice to give to people because it cannot be impossible sometimes. But if you have a brand new baby and you're already not sleeping and you're already tired, adding on top of that a medication that also causes you to be tired can sometimes be a reason that people will suddenly stop taking their medication, which can also be dangerous. So I'm not saying this is not a great medication. It wouldn't have been approved if it didn't have positive benefits, but I think that is something to be really aware of, especially if you are already dealing with a baby that doesn't sleep well. Let's see. All right, children, no fighting in the chat. I said no fighting. Yes, tiredness is a trigger for anxiety reflexes. Anxiety and depression are both triggered by exhaustion, worsened by exhaustion. And then, as the flip side of that also can cause those things, cause more exhaustion or lack of ability to sleep or wanting to sleep too much. It's kind of a circular point. All right. So yeah, 36% is a lot. That's 1 in 3 people are going to experience somnolence, including sedation, which is just being like sedated, obviously. Thank you. You're welcome for explaining that one to you. And hypersomnia, which is sleeping too much, which I think is a tough side effect. Dizziness, 13%. Oof, more than 1 in 10. That's quite a bit too. Hopefully these are things that wane over time, but I'm not sure. Diarrhea, fatigue, and then you get into like the less common urinary tract infection. That's a very bizarre side effect. How do you have that as a side effect? You can see, though, it's about the same as placebo, not much difference. So I don't know if that's actually a statistically significant difference. How would you... Yeah. Okay, COVID-19. Well, yeah. So this, I think, is a good lesson, y'all, in when you see... I think we talked about a couple of the birth control things where they, like, pull out the list of side effects, right? It does not take much for something to end up with a side effect listed in a informational packet. Now, that's not to say that these are not side effects. It's just that the bar to, like, the threshold to exceed for something to be considered a side effect enough to include it in the adverse reactions is anything that happens in more than 2% of people, right? So even if it's not directly related, it is still reported as a side effect, and it technically could be related. That's why they include placebo in this and how many people had that with the placebo. But yeah, I mean, I think it's highly unlikely, right, that this medication is causing people to get COVID. However, it happened more than 2% of patients, and it happened more in the patients who took the medication than placebo. Is this probably a confounding bias of some kind? Most likely. Everybody's on an ad. That's okay. I won't do anything incredibly important while you're gone. It seems like side effects are essentially a witch's curse. Yeah, I mean, it depends, right? So everybody reacts different. And I think this is always the lesson here with any medication, is that you don't know if it's going to have more benefit for you than side effect or than risk until you've taken it. Myalgia. Myalgia is like muscle pain, sore muscles. Yeah, so yeah, learning to read research papers is hard, and it takes a lot of time. And once you do learn how to do it, it takes a lot of continual, like reading other new articles to keep your proficiency up. It's not an easy thing to learn. Hi, Marcel. Thank you for. I was also late. Don't worry. Anyway, we're talking about the newly FDA approved postpartum depression medication. And hang on, what is this? That was 50 milligrams. So let's see. Somnolence is, I don't know. I don't want to read all this. Let's read about breastfeeding. Available data from a clinical lactation study in 14 women indicate that zearanolone is present in low levels in human milk. There are no data on the effects of this in a breastfed infant and limited data on the effects on milk production. The developmental and health benefits of breastfeeding should be considered along with the mother's clinical need and any potential adverse effects for the breastfed child from the underlying maternal condition. A steady state milk study was conducted. Okay, so what they're talking about here is apparently somebody in the study wanted to be in the study and continue to breastfeed. So they did a steady state milk study, which is basically getting the milk from the patient and testing the level of drug metabolite or like testing the amount in the breast milk. So basically, what would the oral dose be that the infant is getting? And they did that over 5 days. At steady state, it was calculated for maximum relative infant dose, less than 1%. Daily infant dose was low, reflecting a mean relative infant dose of 0.357% compared to the maternal dose. Concentrations were below the level of quantification for 4 to 6 days. So this is a really low percent. And I think for the most part, this would be a medication that we would say, like, you know, we definitely don't have data. I cannot tell you it is safe. We don't have data that says it's harmful, and we don't have a reason to think that it would be overtly harmful, but this is going to be a risk-benefit thing. So we have to talk about it, and you have to make that decision. So this is, someone earlier was asking, like, is it a don't take it or a talk to your doctor thing? To me, this is a talk to your doctor thing.